Canopy fit the bill in that it really helped us bring everybody up to the same level. So that was one piece. The other piece was that it's something that they can do on their own time, that we don't have to schedule. Scheduling with the medical students is just extremely difficult, and trying to find a time when they can all meet. And so this is perfect. They can do it whenever they have time. They can take a break from studying biochem and do a little bit of Spanish, or a lot of them will do it mostly in the summer before they start in July. So I think that piece was really helpful. And then I think the other piece that was great was that it really ties in the medical Spanish with also the grammar. So we wanted to make sure that they were getting grammar, but then also they want to feel like they're learning some medical Spanish. So they liked that. And then finally, they really love that it has so many different modalities, that it doesn't get boring. That they can watch a telenovela for a while, they can do flashcards for a while, they can look at read the conversations. There's just so many different pieces to it that we found it really helpful from that standpoint. As a faculty member, I like that it has an evaluation piece, and that I can go back and look and see, how did they do on their quizzes, how far did they get, and how long did it take them to do things. There's a lot of good feedback for me on the reports. So I think there's a lot of great parts about Canopy, and it's worked out really well in our program. The only thing I always have to remind students is that it takes a while to get through it. And so if they think they can get through it in an hour or two, that's not, it's not going to work. They need to make sure that they set aside enough time to get through it all, because we do require that they all finish all three of the levels before they move on. And so for someone who has had limited Spanish grammar or Spanish classes in the past, that is going to take them a little bit longer than folks who've had more Spanish coursework in college, say.